when this bill goes through, and not even when. In fact, by the time you're watching this bill will probably be signed into law. Millions of people will lose their Medicaid related benefits. Medicaid adjacent organizations are going to have to shut down. And there's really nothing you can do about it. And I know we hear the word millions a lot, and sometimes it gets kind of downplayed like it isn't, a big thing. But I want you to think about those millions being your mom, your brother, grandma. How about your niece? All of a sudden can't see their own pediatrician. That is what's about to happen when this time gets official for the bill to take place. And, like I mentioned, there's really nothing we can do about it. So I'm yours truly, Dr. Barry Pierre. We got a special edition of Medicine Mondays, Lunch and Learn with Dr. Barry, where we're going to talk about the big, beautiful bill and the consequences it's going to have on the Black health here in America. Now, of course, obviously, I'll focus on the Black health, but you can assume that if Black health is affected, everyone else is affected. But like I always say, when something goes down the pipe, especially in medicine, if you're Black, you're likely going to feel it a little bit worse than your other counterparts. So today we're going to talk about the big, beautiful bill, which I even hate calling it that. We're going to talk about all of the different segments that will be affected, especially in the health realm, right? Like now it affects other things, but obviously you watch me or you listen to me because you want to hear about health related talk. So here it is. Sit back and get ready. And, in the end, we'll talk about what, if anything, we can do when these changes do occur. So I want to tell you, I did save you guys the trouble from having to read a bill that's about 1,100 pages. And first of all, I didn't read a bill that's 1,100 pages. With technology, right? Y'all know I'm big on my AI. With technology, I got some amazing summaries, right? But I will put a link in the show notes if you want to the actual bill. So if you got time, you want to read it yourself, or you want to put in your own little chat GPT. But let's talk about the first aspect of what's being affected, right? I kind of highlighted in monologue that Medicaid, will be affected. Medicaid cuts in Black safety health net will occur, where it will now strip down Medicaid expansion, increase the red tape for eligibility. There's going to be work requirements now. There's going to be verification after verification. So if you don't work, which you'd be surprised how many people on Medicaid don't work because they cannot work because they're disabled. If you can't verify yourself, and depending on how they're going to expect you to verify, if you're in a rural area, maybe you can't get to the doctor's appointment. Maybe you can't afford a doctor's appointment to get re-verified. That's going to be a problem. It actually cuts into the Children's Insurance, which is the CHIPS Act, CHIP. And why is this important? Why is this important, especially for the Black community? 1 in 3 people on Medicaid are Black, right? 1 in 3 Black adults rely on Medicaid. Black children are more likely to be covered through CHIP. And again, I don't want you to just think about the numbers, right? Let's think about the disease, right? If you have asthma, diabetes, hypertension, high cholesterol, you will be affected by it, right? So that's a big thing. The number of people who are going to be affected are going to be in the millions. You're going to see reports out here that range from 8 to 15 to 17 million people, right, are going to be affected by these Medicaid cuts, these Medicaid requirements. And a lot of them are going to be Black. I just hate to say it. A lot of them are going to be Black. So it's extremely, extremely important for us to really prepare. Fortunately, it doesn't take effect today, but it is going to take effect. And when it does, we need to be ready. All right, part 2. It affects the Affordable Care Act. So it does not cancel it. The Affordable Care Act isn't going away, but it does affect it in certain ways. So it removes ACA subsidies and coverage protections. What does that mean? And again, and I almost have to preference this, especially for those who may be newer to the insurance game, on what it used to be like before the Affordable Care Act and all of the provisions associated with it. You had insurance companies who, with no issues whatsoever, could stop treatment. Like, oh, you know what? You've cost us too much. You're getting off our plan. You had insurance companies who would be like, all right, like I could, like, for example, this is a perfect example. I could be working for a job. On that job, I have insurance, let's say United Health. and then I leave that job. I leave the job for whatever reason, but I want to still continue to, see my same doctor. So I say, hey, United Health, like I would love to stay on, as a, as a customer. And United Health would be like, well, unfortunately, we don't take people with pre-existing conditions. And you're like, but you're the one who helped me diagnose these conditions that you are now calling pre-existing. So you're telling me that you're not going to cover me for conditions that you were the one that helped discover? Yeah, we are. So these are just some of the intricacies and rules that got put into place when the Affordable Care Act came and said, hey, insurance company, we're not going to let you, cap the amount of coverage you can give a patient. We're not going to let you say, hey, you know what? Your pre-existing condition, which could be anemia, which could be pregnancy, which could be hypertension, which could be obesity. We're not going to let you use that as a reason not to insure this person right here. So it has been extremely valuable for people who had trouble getting insurance, couldn't get insurance because they had some pre-existing condition that even if they had the money to pay, the insurance company was like, nope, I want no parts of it. I only want the healthy paying patients, who don't see the doctor very much, which means I can collect all the premium and, live scot-free, right? These are how insurance companies work. Extremely, extremely important. And again, end rules for essential benefits like maternal care and mental health. This week, we're talking about why Black women die much more frequently in healthcare. So now you have a big, beautiful bill, which again, I hate calling it that is now removing those protections for patients who are receiving maternal care, receiving mental health related care. And why it's important, right? Because I think it's always important to know Black women already die 3 times the rate of white women in childbirth. We already talked about this. Mental health care just started becoming accessible. So imagine we just started with the Affordable Care Act, making mental health and the access to mental health accessible. Now we're snatching that away. We're taking it away. Chronic disease management now becomes pay to play. I think that's important. And that kind of highlighted what I mentioned earlier. You had a point where if I'd had hypertension, I had diabetes, I had high cholesterol, long as I could pay my copay, I had insurance who would cover me. Now they're going to be like, oh, you know what? You have high blood pressure. You have diabetes. Even a big one. I know my channel is going to love it. You've been diagnosed with COVID before and you have some respiratory related issues that's still chronic. We don't want to insure you. So you're going to leave millions of people who will now be left uninsured that still need the healthcare, still need their medication, still need a doctor's appointment. And guess what happens? They're going to fill a lot of these emergency rooms because they're uninsured. So they have to go to the one place that can't turn them away. Thank God that wasn't in the provision. So they have to go to the one place that can't turn them away. And then here we go, right? It's just going to be the start. And I hate to say this with all, it's going to sound hyperbolous, but people are going to die. People are going to die when they lose their health care. People are going to die when they can't see their doctor. People are going to die, right, when they lose the protections that were a benefit to them for maternal care, for mental health. They're going to die. And clearly it's been, and the people who voted for this best interest that they say, you know what? We're okay with that. We're okay with that collateral damage. Also, we can get tax cuts for organizations and businesses and people who are millionaires and billionaires, right? Because it has to come from somewhere. I can't stop making them pay their taxes without collecting revenue somewhere. So I got to just spend less over here because I'm going to receive less over there, right? That's essentially what's happened. So again, we have to be very diligent that the Affordable Care Act isn't going away, but it is definitely going to be hampered somewhat because of it. So I talked about the fact that not only is Medicaid affected, not only is the Federal Affordable Care Act going to be affected, you're going to have multiple public health programs be affected. Think about programs for HIV prevention, chronic disease, gun violence, community health centers, public health responses like FEMA. That is going to be severely gutted because of this bill that, again, will take effect today, but won't take effect as far as when the issues, as far as the defunding and everything start till, the year 26. And why is this important? Again, Black communities rely on these programs, for testing, for cancer screenings. And we talked about this, especially during COVID, during the pandemic. one of the things we realized is that because of the pandemic, people weren't seeing their doctors. And at that time, we weren't doing telehealth and everything. So people weren't seeing their doctors. So they were missing a lot of their typical cancer preventive screenings. And what did we see after, the pandemic subsided? That a rise in cancer cases. Because guess what? Cancer that we would have picked up during, the pandemic in that time frame, we couldn't pick up because people missed their appointment. And they just said, you know what, I'll catch the next one. And they never caught the next one. So again, extremely, extremely important when we think about now public health is under attack. Now, again, y'all know me. I got my DO hat, but I have my MPH hat on as well. So I am being hit on both sides with a bill like this when it says, hey, you know what? Like, we need to save, our millionaires and billionaires some money, right? So we're going to take it from here, right? So extremely, extremely important to understand why these issues, because again, without these programs, we're not just underserved, we will now be abandoned, right? It's scary. And again, this episode is going to sound like I'm being very hyperbolous, but this is the real deal facts that are coming down the pipeline that we need to be aware of. All right, so this next one, I like to call it punishing the poor. So we're going to punish the poor, right? And I kind of mentioned the fact that a lot of people are going to be losing the Medicaid. So how and why are they going to be losing the Medicaid? Well, one of the biggest provisions is that they're going to now expect you to work and be on Medicaid. And for those who don't know, right, like you might not, a lot of times to be on Medicaid, you have to have a certain threshold of money you can make, right? And if you make over that threshold, you don't qualify. And if you don't qualify for Medicaid, that means you don't qualify for, assisted living, like Section 8 related housing. So there are a lot of things that happen if you hit past a certain threshold. And a lot of times these jobs, they're very slick with it, right, will pay you just enough to get you over that threshold, but nothing more, nothing more. So a lot of people weren't working. But then there's a faction of people who just cannot work. They're actually physically, mentally disabled. They cannot work. And now you're going to have, provisions that say you have to work if you want to keep your Medicaid and your other related benefits, right? Punishing the poor. And this is another one, right? Why do I think is going to affect us, right? Because it's going to disproportionately target Black adults, right? In low wage jobs, gig work, healthcare will be at risk again, right? Because again, no exceptions for caregivers or those facing systemic unemployment, right? Think about that, right? I'm not even giving you an exception for those who've been disabled. I'm not even giving you an exception. Like, you got to work somewhere. Where are they going to find work at? They're talking every day that AI is taking jobs. And typically AI takes low hanging fruit, labor like intensive jobs. Where are they going to find the work, right? And they know, they're not dumb, right? And I want to make sure I preface this. They're not dumb. They understand that if we put a work requirement in there, guess what? Less people will qualify for Medicaid, right? Because even though I know they can't work, that means they can't qualify for a Medicaid. That means we don't have to pay for their insurance, and then we're good to go, right? Scary times. And we've been under attack as far, especially with our reproductive and sexual health, for quite some time, right? Like, a lot of the campaign was primarily focused on reproductive sexual health, go all the way back to Roe v. Wade. Unfortunately, that has been under attack by, this party and, their constituents for a long time. And now they've been able to kind of access another way to attack it, right? So what does this bill do? It defunds Planned Parenthood, restricting abortion-related services. And why is that important? Because a lot of times when people hear Planned Parenthood, they only think that Planned Parenthood only offers abortions and that's it, which can be further from the truth. What typically happens with Planned Parenthood, you have prenatal care services. A lot of times STI, sexually transmitted infection testing, contraception occurs, right? That it can be offered through Planned Parenthood. So there are a lot of health-related services, especially for women, right, that typically they can't afford to go to these doctors. There's no doctor around them, so they have to go to their local health clinic, which again typically may be a Planned Parenthood. And now that's gone away, right? And then all the fact that they're restricting federal funds to be given to Planned Parenthood, to provide for abortions, right? Which again, a lot of states already kind of do this. Now you have a bill that wants to kind of expand this nationally, right? And again, what's going to happen? If someone's going to have an abortion, they're going to have an abortion. I know this is going to bother, the super Christians who have the means to be able to fly to a different state, which don't have no issues. I know this is going to bother them, but the reality is what the reality is, right? If someone's going to want to have an abortion, they're going to have the abortion. And abortion, now what's going to happen is they're going to find other ways to have an abortion, right? That is going to put the mother and baby possibly at risk, right? So very, very concerning when we think about these public health programs, these community health centers. Planned Parenthood obviously is the big one, right? But a lot of community health centers are going to be affected monetarily, right? Which we're already seeing reports of community health centers and local community hospitals like announcing that, hey, if this happens, if this bill happens, which it did, we're going to shut down. So you're going to see, especially over these next few weeks, more and more people talk about like, hey, we had to shut the hospital down, right? Because guess what? We couldn't afford it, because guess what? Most of our patients who used to saw us were Medicaid. And if they're now going to be uninsured, we can afford to take all those uninsured patients, right? And so I want to make sure people kind of get that and understand that. A lot of these community health centers, these local community hospitals, a lot of their funding comes from seeing their Medicaid patients. So now if you tell me that maybe I used to run 10% uninsured, but 90% insured in what way? Maybe a majority of that insured being Medicaid. Now that 10% may turn to 30%, 40%. I can't afford to be here. I can't afford to be here. And at the end of the day, this is a business. Right? Hospitals are a business. Community health centers are a business. Planned Parenthood is a business. If I can't afford to be here, I'm not going to be here. And guess who suffers? The patient. And now when you think about that, that is where I'm hoping the light bulb turns for a lot of people. When they start realizing that, hold on, you mean to tell me all of these services that are going to affect and benefit me, right, is going to get cut, but the only thing those who are of a much higher financial need, organizations that make billions of dollars per quarter, are going to be saving billions of dollars thanks to these types of cuts? Are you telling me like they get the benefit, but I don't? Yes, like that is exactly, unfortunately, what's happened, and we're going to have to deal with it. So this is one where I want people to think about it, not necessarily from a direct medical, right? Like, restriction occur, but from an environmental, this is where I put my public health hat on, right? Environmental rollbacks, especially in low income neighborhoods, rural neighborhoods, where do you think the majority of Black people stay? Will gut EPA authority and climate justice programs. And we talked about climate and environmental related racism, especially when we talked about COVID, right? Because when people are very concerned about COVID, the biggest thing for them is ventilation. And they were going to schools with poor ventilation. They were going to jobs in places with poor ventilation. And what population of people you think are going to be likely affected when the protections that are supposed to be there to help prevent the spread of disease, is no longer there, because we decided we rather fire these people and again save and send the money for our millionaires and billionaires. Like this is a problem. Higher asthma rates, cancer clusters, and polluted water are going to be likely associated with fewer protections. So think about this. Higher asthma related rates, that's respiratory rates. Think about our COPDers, think about our COVID, our pneumonia exacerbations, cancer clusters. So because these, again, you have these environmental protections that are no longer there. So, like businesses come in, they can pollute, they can have gas, they can do all these things there, which are going to increase the different types of cancers that may be like airborne related or toxin related to the like food supply or water supply. That's going to go up. And then we talked about the polluted water, right? So again, they poison our air, but now they took away the alarm system. They poison the waters, but now they took away the alarm system. This is scary times, y'all. I don't want to sugarcoat this. That's why I had to do a special episode, because I have episodes that are just kind of in the queue. So this wouldn't have been the next one coming out, but I was like, no. I got to do an episode like ASAP and talk about it. I would have went live, but I said, you know what? Let me just drop it on YouTube and then make it official so more people can get it. And it will be on the podcast as well, too. If you're not subscribed, Lunch and Learn with Dr. Barry, make sure you subscribe to that. So extremely, extremely, extremely important. And I don't, as a parting shot, right? I don't want us, right, running for the hills or looking for a passport to try to leave here, because majority of the people who I'm talking to don't have a passport or couldn't afford to just leave anyway. At first, why would you want to leave this country? But it's going to be some scary times. There's going to be a lot of people who lose their insurance. There's going to be a lot of people who can't afford, these new restrictions, who can't afford these new rules. There's going to be a lot of people who are going to die. And we have to be ready for that. And we have to be okay with the fact that you have a good significant amount of the population here in the United States that was okay for this type of plan to happen, because it's not like it came out the wazoo. You knew it was going to occur, and you know what? They still voted for it anyways, right? So those are going to be our parting shots, especially for the medical side. And there's a few more, but I didn't want to like go into nitty gritty details. Like I said, it is like 1,100 pages. But I will put a link to the bill if for some reason you want to read it, or more importantly, or easier, you just want to put in your own AI bot and say, hey, can this bill affect me? And you'd be surprised at the answers.